My name is Marilyn Arnold, and I am from Lee Summit, Missouri. I joined Impact January 1st of 2020. Ever since my retirement, my husband and I had been looking for a good supplement to Medicare. And I found plans that were expensive. I found plans that had poor coverage, and I also found plans that were expensive and had poor coverage. So I got very frustrated and ended up just taking a plan that paid everything. I didn't have to worry about it. It just happened. And that was great until the fall of 2019. I received a premium notice in the mail that my premium had gone up to $630 a month. That was about a 50% increase. By the time I sat down and I figured out how much our total health coverage was going to cost, and Medicare, people think Medicare is free, but it isn't free. It was going to cost us over $9,000 a year. And I don't know if people realize this, but inflation, when you are a retired person, is bad. It's very, very difficult because you truly are on a fixed income. Plus you get concerned about how long is my money going to last. People are living longer now than they ever have before. And it's a genuine concern. And I decided I needed to take a look at this. So I started doing my research, and I found out that, number one, I could drop from $630 a month to $230 a month. My medical need for myself, I'm pretty healthy, but my husband has congenital heart failure. And we go to the doctor quite often. We go to the emergency room. He also has AFib. So his medical bills are a lot, and we never know when we're going to have to go. The great thing about our Medicare supplement and Medicare itself is that there are no pre-existing conditions. So when you go on our Impact, everything is covered immediately. There's no wait. So that has worked out very, very well for us. We had recently, my husband had a bill that was $140,000. We paid $100. So it's awesome. Not only do we hear from people who have shared our medical bills, we also hear from people who we have shared their medical bills, which gives us the opportunity to pray for them. And it really gives you so much more of a personal feeling, and it's just a good feeling inside. In our world today, there is so much that is not personal. It's so impersonal. And with Impact, it's personal. You feel like you're a part of a group, and you know these people, and you're helping and they're helping you. So it's just such a wonderful concept, and which makes us a tighter group and gives us more reason and it's also more reason to share with people, because it really reaches your heart and it gives you the passion to go out and share the information with others. Impact works exactly the same with Medicare as any other Medicare supplement. Medicare is divided into three parts. We have Part A, which is the best way to look at that is that's a hospital bill. Medicare covers 100% of whatever is on a hospital bill. Part B is everything else. Your outpatient, it's your doctor, it's your oncologist, it's your x-rays, it's anything that you do. When you have something, let's say that you have something, x-rays at the hospital, and the hospital charges $1,000. Medicare then will approve a certain amount of that. And for example, let's say that approves $800. Of that $800, Medicare will pay 80%. Or in our example, it will pay $640, which leaves you with $160. Once you reach $1,000 of the 20%, what you are responsible for, Impact is going to kick in and they're going to pay 100%. You will have no more bills. And the great part of it is, in the last 2 years, with my husband having the bills that he's had, we've not reached the $1,000. Last year we paid in $567. So it's just been, plus in 2 years we've saved $9,600. I have had questions. One of the questions that I have with people is they're concerned because Impact is new, and your doctor or your hospital may not be familiar with them. We've had no problems whatsoever. We basically gave them our new card, our Impact card. They took down our information, and then they file all of our claims for us, just like they do with Medicare and any other coverage. And then whatever your share is, you get a bill. If I could give anyone advice, if you are over 65, definitely check out Impact.